Hello everyone, and thank you for watching this. I'll be presenting a case about atrial fibrillation after COVID vaccine. I would like to thank and acknowledge the rest of the authors. Coronavirus disease COVID-19 vaccines, including mRNA-1273 Moderna and BNT162b2 Pfizer, are associated with heart rhythm disorders, myocarditis, and pericarditis. Atrial fibrillation usually occurs within the first month after any dose of vaccine. We present a case of a young patient who presented with new onset paroxysmal AFib after receiving mRNA-1273 vaccine. A 38-year-old man with past medical history of hypertension and hyperlipidemia presented with palpitation 20 days after receiving his first dose of mRNA-1273 vaccine. He was admitted to the hospital and his EKG was significant for AFib with rapid ventricular response. He underwent direct current cardioversion within 24 hours of initiation of his AFib. His pre-procedural TEE was negative for presence of thrombus in the left atrial appendage. His transthoracic echocardiogram showed normal heart structure and function. Right and left atria were normal in size. He was placed on apixaban for a month after the cardioversion. He had a normal exercise test with excellent exercise tolerance and Duke score of 13. 24-hour Holter monitor did not show evidence of AFib. His CHA2DS2-VASc was 1 due to hypertension, and after a month with anticoagulation, he was placed on aspirin 325 mg daily. Patient received 2 doses of the same vaccine 10 and 13 months after the first dose without any recurrence of AFib. Patient was seen in EP clinic in 1 year, and he was completely free of symptoms at that time. COVID infection and mRNA COVID vaccines both increase the risk of myocarditis, pericarditis, and cardiac arrhythmias, including AFib. We propose that vaccine-induced cardiac inflammation triggers AFib. While this case shows a new onset paroxysmal AFib after vaccine in a healthy individual, we have seen cases of AFib recurrence in our patients with prior successful AFib ablations. Since the post-vaccine inflammation is mainly transient, we do not typically perform ablation in these cases. The proposed role of inflammation in AFib after COVID vaccine needs to be further studied, especially since the current imaging modalities, including cardiac MRI, cannot evaluate for myocarditis in the atria. In conclusion, mRNA vaccines are associated with AFib with a proposed underlying mechanism of inflammation. Immediate cardioversion is an effective treatment strategy, especially in the young population with otherwise normal hearts. Short duration of anticoagulation following the cardioversion is sufficient in patients with low stroke risk and no evidence of AFib recurrence on cardiac monitoring. AFib incidence with 1 dose of vaccine should not necessarily prohibit future administration of mRNA vaccines. Thank you again.